Greetings from Indian Medical Association. I am Dr. K.K. Agarwal, Honorary Secretary General IMA and President Heartcare Foundation of India. Welcome to our weekly webcast show where we discuss one particular subject. This can be viewed in emedinexus.com website, IMA website. This can also be viewed not only by the IMA doctors but also by the general public, because we take up issues which are of importance to general public. Today is a special webcast, being a breastfeeding week, and whenever a breastfeeding week comes, IMA always has been associating with IMA Johnson & Johnson initiative to promote the concept of breastfeeding. Last year we have brought you lots of advertisement, social advertisement with Johnson & Johnson, and this year we are presenting to you a webcast on exclusively on neonatal care with special reference to breastfeeding. And our expert today is Dr. Naveen Gupta, to my right. He is MD Pediatrics and DM Neonatology. He did his fellowship in neonatology from Canada. He is a newborn and child specialist. He is a consultant at Max Super Specialty Hospital, Patparganj. He has studied in Surat, he has studied in Gangaram Hospital, and he has studied in Vancouver. Welcome to our show, Naveen.
Thank you.
To my left, I have with me Dr. N.V. Kamath, who is a former Director Health Services, Government of Delhi, who understands lots of laws and government programs, and he is presently a principal advisor to Indian Medical Association. So let's start with our program today. When we talk about a breastfeeding week, 1st to 8th of August, what is the theme this year, Naveen?
So, thank you, Dr. Agarwal, for such a nice introduction. So, the theme in this breastfeeding week is that breastfeeding are key to attainment of sustainable development goals. So, sustainable development goals are the next step to Millennium Development Goal. These goals were formulated last year in 2015 by all the world leaders, and 17 of these sustainable goals have been formulated, and our goal is to attain all these goals by the end of 2030 so that we can eradicate poverty from the world, and we can attain equality between rich and poor, and we can also address the things which are leading to the climate change. Breastfeeding as such.
Let me go back. When we talk about sustainable development goals, and breastfeeding is one of the major things. If you follow that, you should be able to take care of many goals simultaneously.
Yes.
And if I'm given to understand, the WHO said Sustainable Development Goal 1, 2, 3, 4, 8, and 10 out of 17.
Exactly.
You should be able to. Can we a little bit talk about say 2 and 3 talks about hunger, nutrition, promoting health and well-being?
Yeah.
Can you elaborate?
Yeah. So, say breastfeeding is, we say that breastfeeding is a most natural way. It is sustainable, it is affordable, there is no cost involved with it. So, definitely it can, if we give exclusive breastfeeding for the first 6 months and then continue it till the 2 years of life, then it can eliminate hunger in this age group, right? It is how it can lead to better economy by two ways. A, it is a cost-effective method. On the contrary, if we give formula, which can be harmful for the child also, but that cost also too much. Say in American figures, the formula cost around $10,000 per year to a family for a normal term baby. So we can save all this cost. Second thing is that breastfeeding, exclusive breastfeeding in the long run leads to better neurodevelopment outcome. And
let me
yeah.
The Sustainable Development Goal 4 is education, lifelong learning, and 1, 8, and 10 they leads to poverty, promoting economic growth, and reducing inequalities.
Yeah.
So they all are. This is what you're talking about.
Yeah.
So if there is a breastfeeding,
Right.
Long term, how do I measure it? In terms of IQ, in terms of annual death, diarrhea, respiratory, are the numbers available?
Yeah. So there are some, lot of evidence, lot of research has been done into this, and the data suggests that if the breastfeeding is continued for a long time, vis-a-vis breastfeeding is done for a short time, the children in whom the breastfeeding has been done for a long time, their IQ is better by a mean of around 3. And this translates into better academic performance also. And for the country, if we measure, say for India, it can translate into a gross capital income of raised by 4,300 crores, which is in fact a substantial
So
amount.
better economy.
So better economy.
Okay. What about mortality?
So mortality,
0 to 5 years.
yeah, so 0 to 5 years breastfeeding alone can lead to reduction in 13% under 5 mortality rate. So if it comes to India, that can translate into saving 1,000, approximately 1,56,000 lives every year of under 5 children. And similarly, this also translate into reduced hospitalization rates, reduced chances of diarrhea. Diarrhea episode can be reduced by approximately 39 lakh cases of diarrhea episodes and 34 lakh cases of respiratory tract infections in the first 2 years of life can be reduced by giving exclusive breastfeeding for first 6 months and continuing it for the 2 years of life.
What about the benefit to the mother in terms of breast cancer?
Yeah, so breastfeeding leads to substantial reduction in breast cancer as well as ovarian cancer. If we look for the figures of breast cancer, approximately 5 to 7,000 cases of breast cancer every yearly can be reduced if exclusive breastfeeding is being practiced.
Before I go further, let me come back to the policy, and I want it IMA, IAP, and NNF policy, so that everybody endorses. A, cholesterol is important.
Yeah, cholesterol is very important. So cholesterol
Okay.
is the first milk. It is thick, it is yellow, it is rich in immunoglobulin, very high content of protein. It provides lot of anti-infective properties to the baby, and it strengthens the immune response. So it should always be.
So cholesterol is important, but only 40%.
So, but yeah, if we look at the National Family Health Survey 4 data, which is the recent data, in spite of the institutional delivery rate rising to 84.2% because of good programs like Janani Suraksha Yojana, etc., still the initiation of the breastfeeding, which is recommended to be done in the first hour of life, the rate is approximately 40 to 43% only.
So the first message has to be that we need to bring it to at least 84.2%.
Yeah. So message should start in the antenatal period only. Mother should be counseled at every antenatal visit by the healthcare personnel.
So the first colostrum should not be ignored.
Should not be
breastfeeding should start within 1 hour.
1 hour, yeah.
Exclusive breastfeeding for 6 months.
For 6 months.
I have a point here. What does exclusive means?
So exclusive
That means no water?
that
That means no-
that means no water, no water, no other food apart from breast milk. Only medications can be given.
So therefore all how do I give the drugs without water?
So there are now majority of the neonatal and infantile drugs, they are available in the suspension form. So which can be given.
So except for the drugs,
Except for the drugs, nothing.
what about diarrhea? Can I give ORS?
So preferably in the first 6 months of life, the milk has sufficient water content. Milk also contains sodium also.
The child suffers from diarrhea.
Yeah. So we should frequently feed the
So
child.
0 to 6 months, diarrhea can happen.
Yeah, diarrhea
If
can
the
happen.
child has diarrhea, do I give ORS or not?
So ORS can be given, but majority of the frequent feeding is always the advice in the first 6 months. Even
I
if the
said
child
don't
is
ignore feeding, that's fine.
Right.
But if the child is dehydrated,
So we can give.
you
we
can
can.
give. So therefore, we say is in normal circumstances, exclusive breastfeeding,
Is the
even if there is a diarrhea, continue breastfeeding. Even if the child is sick, continue breastfeeding. At 6 months, you start complementary feed,
yes.
and then continue breastfeeding for 2 years.
For 2 years.
Okay. Now, is it up to 2 years or
So
2 years?
it can go even beyond 2 years also.
So beyond 2 years also.
Yeah. The recent WHO guidelines are that we can continue it beyond 2 years.
Okay. So if my now thing comes is that when I say breastfeeding, so breastfeeding is an art,
Yes.
and that's the reason there were joint families.
Right.
The mother-in-law and the mother,
They used to teach.
they used to teach, and they used to say that after birth, let the girl go to mother's house for a few weeks, so that's a part of learning.
Yeah.
That's a part of learning. Now we have a skill development ministry, and I've been aware that 40,000 diabetic educators are being trained. Is there any policy? Is there any scheme? Is anybody thinking about training the
So
only
there is-
that means I have exclusive manpower army of ladies available who can be hired for 6 weeks and they can come and train.
So it's not like that, but the concept of lactational counselor is now being promoted at both at the public sector as well as the private sector, and the counseling sessions which are being done in the antenatal period, breastfeeding and promotion and the benefits of breastfeeding, they are being told to the mother.
So there are concept
There
of
are
lactational
lactational
counselor.
counselor.
Is my
There
Asha
is-
worker trained in that?
So yeah, so the idea of the government is that Asha worker is also being trained in that. There is Breastfeeding Promotion Network of India, and this Society of Breastfeeding Promotion Network of India, which was laid in 1991 in Wardha, Maharashtra. The purpose of this society is to do all the research related to breast milk and to promote breastfeeding and to bring it to the level which we want, that is 90 to 100% of the babies should be exclusive breastfed.
Any other government policy do we have, Dr. Kamath?
Yeah, government is promoting nationwide breastfeeding program through a new initiative which is being launched tomorrow, that is 5th, all over India. That is called as MA program, that is Mother's Absolute Affection. So this is a program to promote and support the existing services which are available all over India. In last few years, as Gupta has told, that the hospital deliveries are increasing, but at the same time, the proportionate breastfeeding cases are not increasing. So there are many people, especially those in the elite group, the people who are employed, the people who want to have their good fitness conscious people. These people, they avoid to continue with the breastfeeding after few days or few weeks for the babies. And this is the reason it is found that nearly 40% of the people who are delivering in the private sector, they are not continuing for the breastfeeding. And this is the reason the government wants to promote both the breastfeeding program in government as well as in private sector. And there is an existing structure which is called the IYCF, Infant Young Child Feeding Counseling Centers, and through this the doctors, the nurses, ANMs as well as ASHAs, they all get trainings. The most of the trainings are being done to and through the doctors and the qualified nurses. Now the government is also proposing to employ the counselors for this breast promotion, other than these 4 categories, who will be exclusively involved in the counseling of the.
But are they available today to the general public? I'm not talking about those deliveries which are happening in government hospitals.
Yeah.
But suppose there is a delivery on my neighbor's house, and they have a delivery, institutional delivery. They have come home. Now they want a counseling. Is it available to them, or they have to go, if they go back to a private hospital, it may cost them?
Actually, there is no provision of IYCF centers in the private hospitals, unfortunately. It should have been there, but unfortunately that provision is not there in the private hospital. But in almost all the government hospitals of a medium-sized hospitals, where you get the sufficient number of workload of the deliveries, there are IYCF centers, and the counseling starts from the day the patient visits in the antenatal checkup and goes throughout the postnatal period.
Again, see, when you talk about how many births take place in the country?
So approximately 25 million babies are born.
25 million means 2.5 crores. Okay. Then-
I think this is this is the world figure. So in the country,
5 million.
5 million. Yeah.
So 5 billion births. And how many of them reach 0 to 5 years?
So our under 5 mortality rate is around infant mortality rate is somewhere around 30, 34, and under 5 is around 15 per 1,000 live birth.
15?
Per 1,000 live birth.
And infant mortality rate is?
Infant mortality rate is somewhere around 30 per 1000 live birth.
It can be. But has to be less than 0 to 5 years. Anyway, whatever it is, we don't want to go into the numbers. We are talking about a large number of children, a large number
of children they
births,
die in the first 5 years.
they die in the first 5 years.
Yeah, and
So-
exclusive breastfeeding is one of the ways by which we
So,
can
so,
reduce
so,
this.
so from my point of view, this 0 to 5 years mortality practically should be zero from preventable causes,
Yeah,
unless you have a non-preventable cause.
yeah,
If you have some national calamity, this and that,
true.
you develop dengue,
True. So child should not be dying of infections or
Preventable.
Preventable causes.
preventable causes, he should not be dying. He should not be dying because vaccination was not done. He should not be dying because breastfeeding was not done.
Mm.
So therefore, every death should be audited.
True.
So every death should be audited. So there is no way you can have a program separately for the government or from the private sector.
No. there
So
should
if
be
the government is
partnership.
promoting counselors for breastfeeding counselor should be available in private sector. It may be should become mandatory every hospital to have a counseling center. Same facilities which are there in the government sector to be there in the private sector. They should be mandatory.
Yeah.
Otherwise, our 0 to 5 year mortality will never come down.
Yeah. True.
That's the way I look at it.
So yeah, so public-private partnership is actually the key in healthcare sector like India. In all
No
these
private
aspects.
partnership. Same facilities has to be there. It should be mandatory to do that with that. Now, I should have started with that. Let's redefine our terms.
Right.
Let's redefine our terms. So my first term is, what is a live fetus?
So live fetus, as per the American Academy of Pediatrics neonatal resuscitation guidelines, we should not start resuscitation if the baby is less than 23 weeks gestational age or if the child is weighing less than 400 grams at the time of birth. Anything above that, we can resuscitate the
Don't you think that the MTP Act we allowed up to 20 weeks abortions,
Mhm.
and after 20 weeks abortions are not allowed.
Yeah,
That means after 20 weeks, anything is a delivery
anything is a delivery too.
by MTP Act.
So, yeah.
So therefore, instead of 23 weeks, it should be 20 weeks.
So, but
Or the MTP Act should allow it to, as they are talking about making it 24 weeks.
So yes, so I will say that 20 to 23 weeks is the gray zone.
And
It's
less
the
than
gray
400 grams, they
But-
say that.
So because if the child is less than 23 weeks gestational age, he's not like the chances of, even if we save the child, the chances of severe disability when the child grows older, it's very high. So that is why.
And what about weight?
So weight similarly, if the child is less than 400 grams, so he is not. As per the current facilities they trend, we are not able to save the child. The lowest survivor, there are reports of, somewhere around 400 grams, but the recommendations still hold true that less than 23 grams, less than 400 grams.
So
less than
when there is a fetus who's come out of the life, born, day one, you say start colostrum in the first hour
term baby.
and breastfeeding in the first hour.
Yeah,
So for that, you need child with the mother as early as possible.
as early as possible.
So you
So preferably nowadays in resuscitation, if the child cries after birth, we say do not separate the child from the mother. Provide warmth on the mother's lap only. Say the baby is being born, and we say that we should not cut the umbilical cord immediately. So we should delay the umbilical cord cutting by 1.5 months. So if the
Why
baby is
1.5?
1.5 minutes, sorry.
Huh.
Yeah. Why? Because that will help reducing the chances of iron deficiency anemia when the child grow older. And in the preterm baby, this leads to.
So you're basically by talking about 60 to 80 ml of cord blood,
So that let it go to the baby.
let it go to the baby.
Yeah, because that is more natural. So what happens is, if the baby is being born, after that baby is received in a warm towel and baby is being put on the mother's abdomen, and actually there is a phenomena which is called breast crawl, and baby crawls and reaches to the breast and starts sucking. So mum and baby should not be separated, and this is the most important finding, and it has been seen that if we initiate breastfeeding in the first hour of life, then the chances of that baby being exclusively breastfed is very high.
But is that happening today? I mean, what is the percentage of time we are waiting for 1.5
So
minutes?
as per neonatal resuscitation guidelines of India, we should not, if a baby is being crying at the time of birth and the child is a term baby, we should not separate the baby from the mother, and that baby should not be provided warmth in the radiant warmer. We should actually keep that child with the mother.
And cord should not be cut for 1.5 minutes.
One
This
and a half
is
months.
followed.
Yeah. Yeah, so we follow this in our hospital.
Hmm.
We follow.
Okay, so
These are the guidelines
that's
in majority of the
immediately.
universities.
Anything else we do immediately? Anything we do it with? Suppose the child is meconium stained. Do I clean it?
Yeah, when the baby is being born, adequate warmth is being provided. So baby is because wet, so babies should be dry. So first taken in a warm linen, then dry, then throw that the wet linen, place another warm linen, and then provide skin to skin contact with the mother. Then do the cold clamping after 1.5 minutes, and then assist the baby for breathing activity and color. And
So when I say 0 to 6 months exclusive breastfeeding, let me redefine what does exclusive means.
So exclusive means nothing apart from breast milk and medication should be given by mouth.
Which medication?
No food.
Unless routinely.
So
the vaccines, oral vaccines.
Yeah, so routinely as per Government of India, no medication needs to be given in the first 6 months of life. But the American Academy of Pediatric Guidelines states that vitamin D should be supplemented at a dose of 400 international unit daily for the first year of life. And many units in India, they are being following this because vitamin D deficiency is rampant in the country.
So therefore, ultimately, the child will need vitamin D or some drops, say oral polioviral and other things.
So and immunizations.
And immunization. No water.
No water.
No coconut water.
No coconut water. No pre-lactal feed. No honey. Nothing.
Nothing. So only exclusive breastfeeding and medications as advised by your pediatrician.
No top feeds.
No top feeds.
No top.
So at 0 to 6 months, we start with the complementary feeds.
Yeah, once the child is 6 months.
Is there anything special for that?
So in complementary feeds also, if we start with the homemade food, that is always beneficial as compared to, if you start with the.
So in terms of the milestone at 6 months, how the child behaves?
So normally a 6-month baby should be, if I look at the motor milestone, the baby should be turning around, complete head control should be achieved, the baby should be reaching for the objects, transferring objects from one hand to the other. Baby should start something like babbling and monosyllable words should be there.
Sitting.
And sitting with support comes somewhere between 6 to 7 months. With the support of hands, and sitting without support comes somewhere around 9 months.
So can we come out with some formula that 6 months is?
So
fine.
6 months is 6 months is where the baby should roll over completely, complete head hold, babbling or monosyllable, and very good interaction with the mother, and transfer objects from one hand to other.
And at that time when you say continue breastfeeding along with your complementary feeds, continue breastfeeding as it was.
So no. So previously the breastfeeding was more of a demand feeding, and now because we will introduce complementary feeding, then definitely as the child will grow older, the breastfeeding alone cannot provide all the nutrients to the baby. So he should be fed adequate feeds.
Suppose you are giving feeding. How many feeds 0 to 6 months in 24 hours?
Around 7 to 8 feeds.
7 to 8 feeds.
Yeah.
So now 6 months onwards, is the number stays same?
So number will keep on decreasing. Say by 1 year we say that 3 to 4 times breastfeed is sufficient.
And that's the reason in our maternity benefit we normally
Take 6 months.
Till 6 months. Yeah, after 6 months your frequency reduces so that.
Yeah, mother can go for work also.
Now, what are the options available for a mother who is a working mother? What are the options available?
So
how can she still breastfeed and not breastfeed? Breastfeed milk but not breastfeeding.
So she can express her milk. So she should feed more frequently during night, right? And before going to work, she should breastfeed the child, and then she can express her milk and store it in the refrigerator for 24 hours. It remains safe. And when the caretaker has to feed the child, then they should bring the child out of the refrigerator, and we should not heat that milk. That will destroy.
What is the normal
requirement
of a child
at 6 months?
0 to 6 months.
So 0 to 6 months, roughly average weight of the child will be somewhere between 3 to 6 kilos. So the average requirement of formula will be somewhere between 500 to 700 ml. The average requirement of milk.
So the mother on an average produces this much amount of milk. And when she expresses her milk, how much comes out?
So at 6 months, at one go, she can express somewhere between 60 to 100 ml milk.
So if a mother is supposed to feed every few hours, it's not possible to express
But there is law also that if she is working close, then apart from her break, she should be given 2 breaks extra.
three.
If she is feeding,
So
3
8
breaks
hours
extra
free,
till
so every
15
3
days.
hours.
Yeah, but as the baby grows older, the baby can do the demand feed, and baby start taking more milk at one time, and the amount of feeding it reduces to around somewhere around 5-6 also.
No, I'm only trying to find out a solution because practical difficulty. Mother is
Practical
working.
difficulty, yeah.
As on today, we don't have a 6 months maternity leave.
So around 6
don't
months,
have.
it's somewhere less than 8. So 8 feeding are recommended for a baby who is being born in the first month of life. Then when the baby grows older, he tries to suck out more milk. He drinks more milk at one time, and the interval between the feeds is slightly longer.
Okay. Anything else in the breastfeeding? Do you want to cover it up? What are the
So I think
myths,
it's good for the
difficulties?
myths are that myths first is regarding colostrum, that it should be discarded, it should never be. Second is that give some particular food to the child, to the mother, or if the mother eats something else, that the baby will fell sick. But mother's food doesn't account for the baby's health. Mother should eat healthy. She should drink lot of fluid in the first in the time when she is lactating, and she should be provided with adequate minerals etc. by ways of fruits and vegetables. And her diet should also contain, and it should be a balanced diet. It should contain adequate proteins and fats also. The breastfeeding is also very beneficial for the mother also. It helps in because of oxytocin release, it helps in involution of uterus, and the postpartum bleeding is less, so chances of anemia is less in the mother. A natural way of contraception, because it will lead to the amenorrhea will continue, and risk of ovarian and breast cancer is definitely less for the mothers who are exclusively breastfed. And it also helped the mother to come to the original shape, the shape in which she was before pregnancy, very early. It leads to
So what
less
about
chances.
lots of people are talking about milk banks?
Right.
Are they valid? Are they ethical? Can we go ahead with them?
Yeah, so very nice and I think very relevant topic you have touched upon. So milk bank is for preterm babies. Like this, still direct breastfeeding, we were talking of the term babies. Now breast milk has got so many benefits that even in a preterm baby, a baby who is born at 1 kilo, a baby who we cannot feed directly, in that also, if breast milk is being given, there are a lot of benefits. Chances of sepsis are low. Chances of NEC. NEC is the most devastating illness for a premature baby, necrotizing enterocolitis, and chances are 6 times lower in babies who are being fed mother's milk vis-a-vis the babies who are being fed formula milk. So mother milk is very important, but problem is that the parents are very anxious, parents are under a lot of stress, they have given birth, the pregnancy has been terminated early, and because of many reasons the breast milk production is not very high for the own baby. So then there comes a place for a donor human milk, right? But
So similarly add surrogacy breastfeeding. I'm talking about a donor's milk,
Okay.
and second is if
if
somebody's
there
child
is
is died,
Hmm.
she is breastfeeding,
right,
can she be hired by a person for
So-
breastfeeding somebody else's child?
right. So
One is bank, second is
second is this, right? So if we come to the bank issue, so basically bank, there are no, unfortunately, major public sector banks, because this has to be taken on the government level. There is one human milk bank in the KEM hospital in Mumbai,
Hmm.
and one has been opened in the private sector in Delhi only, just 1 month back by Fortis Lafan.
Hmm.
But there is a huge need of this thing, and the government should look into this, because this can prevent lot of deaths in the premature babies.
What about the
Regarding
twins,
surrogacy.
triplets?
So for twins, actually, the basically nature has made it in such a way that mother's milk is sufficient even for the twins.
So the
So
milk production will
the
be
milk
more.
production is more, yeah.
And
Because
so there
both
are-
the babies suckle and the oxytocin release is more, prolactin is more, and that suffices for them.
And what about surrogacy?
So surrogacy, actually in India there is no clear-cut law for surrogacy. So things are in a real grey zone. Now I think the law has come that it's not. I mean, still the guidelines, they are not clear-cut for the surrogacy. So
What about the ISM law? No? IMS. Tell something about the IMS Act.
The infant milk substitution.
Hmm.
So, so in any form to promote breastfeeding, in any form, the formula should not be marketed, should not be advertised. There should be no direct link between the formula company and the healthcare advisor. Before the age of 2 years, if any milk product is being marketed, then on that it is always written the warning that breast milk is breast milk
So
for
it
the
is.
child.
It has to be available, but it cannot be
But
marketed.
it can
It cannot be marketed. It cannot be advertised.
Yeah.
Even if doctors indulge into it, they can be punished.
Yeah, they can be punished.
They can be.
And there should be no activity sponsored by any of these formula companies, and government should take strict action so that this is being followed.
So anything else in breastfeeding? Do you have?
Yeah, you were talking about the twins. In twins, because the human body is such, the milk production is directly proportional to the demand of the baby.
Yeah.
If the babies want more milk, the more milk is being produced.
Mhm.
And secondly, if the baby, for some reason, if the baby is not able to suckle properly, then the milk production decreases. And there is the baby with a cleft lip, or if there is some problem in the nipple, if the technique of breastfeeding is not proper, then gradually the milk production decreases. And I have seen patients coming within 1 or 2 months that their milk production has stopped, the baby is not sucking milk. These are the people who require counseling regarding the breastfeeding, and if we train them properly how to breastfeed the babies in the proper technique, the milk production can be regained after the gap of 2 months, 3 months, 4 months, like that. That can be.
True, very
So lactational counselors are required.
Counselors are required. Proper positioning and
So if
attachment.
nothing more as far as breastfeeding is concerned, let's go back to other neonatal care. And another neonatal care which most of the GPs face is neonatal skin care. Can you a little bit elaborate on neonatal skin care?
Yeah.
And then we come back to neonatal temperature care, skin care, and then care of the jaundice.
So, for the skin care, we should, the normal pH of a newborn skin is somewhere slightly acidic. So, for maintenance of the temperature, because hypothermia is the most common thing in Indian scenario, which can lead to the neonatal morbidity. So, to prevent hypothermia, in India, normal practice is to postpone bathing. As compared to, if I say, in the developed part of the world, every newborn is given bath once the child is being born, so that the secretions are being wiped off. In skin care, second important thing is that once we start bathing, then we should use the products whose pH is similar to the skin pH. And there are some kind of neonatal skin disorders which are very common, and they do not need any treatment. The most common of them is the toxicum, erythema toxicum, in which there is a maculopapular rash on an erythematous base. It normally starts somewhere between birth to first 3 days, and it lasts till 3 to 4 weeks and then subsides on its own. Similarly, transient pustular melanosis is very common.
We were taught there is a number for pustules.
Yeah, so if the number is very high, say more than 10, then you need to go to the healthcare, and this may
so
be.
up to 10 pustules are okay. But if the pustules are more than 10 in the neonatal, you need to consult your doctor. You may need some treatment.
Yeah, you may need some.
So anything else in the skin care?
No, I think.
Powder, something.
So we should try to avoid cosmetics as much as possible.
Diapers.
So diapers. So a traditional thought was that there is a diaper rash which happened because of the diaper, but now the research indicates that the rash happens mainly because of the mixing of the urine and stool that comes in contact with the baby's bum. So the AP guidelines are that if we need to use diaper, we should change them every 3 hours at least, or if it is soiled before that. Soiled means if the baby has passed motion. Cloth nappies, the only the benefit is that as soon as it is wet, we tend to change it. So both of them has been their place. But if we say cloth nappies, if they are not being changed, then the chances of rash with cloth nappies also is very high.
Okay, so apart from skin care, anything else in neonatal care?
I
What
think,
about regulation of
about-
temperature?
yeah. So that is the key. So mm, our belief is that we should be doing, at least every unit should be doing basic care for the temperature maintenance, and by this we can prevent many neonatal deaths. Even if we do not have hi-fi NICU setups in the country, but if everybody takes care of these basic things, so maintenance of temperature, provision of adequate feeds, these are two basic things.
True. When
So
I talk about
skin is-
why kangaroo care for preterm? Why not give the term?
So kangaroo care should be practiced even for the term baby also, even for the term baby. Mother should
The
be
routine. Why should we
Yeah.
say for a specifically for a preterm? We say
So-
as you take the child, kangaroo care should be a
Kangaroo
part
care
of it.
should be- Yeah, yeah. So actually the routine care, the concept of routine care in which the immediately after birth we have omitted even taking the child to the radiant warmer, and we say that start providing warmth by skin to skin contact with the mother,
Not even to the cradle.
not even to the cradle. So there is no need of a cradle. So there should be, and we say that child should be lying on the same bed as the mother, and whenever she is comfortable, she should do kangaroo mother care session, in which the front of the baby is naked, front of mother is naked, and they both come in contact, and this leads to better weight gain. In the preterm babies, this lead to less episodes of
There is
apneas,
a question which has come,
pericarditis,
and he hasn't written the name. It is the phone number is 944322670. He hasn't written his name. He says, "Why breastfeeding rates in India are very low, and what is your suggestion to improve the rate?"
Right. So, breastfeeding rates are low in India. The thing is that to improve the breastfeeding rate, we need to start it from the antenatal period. So, in at each antenatal visit, the healthcare personnel should sensitize the mother regarding breastfeeding. She should be discussing this with the husband also. The mother's nipple should be evaluated, that if they are already flat or inverted, that should be taken care of. Mother should be taught about the importance of colostrum, so that she is very ready and very fit, that once the baby is born, she has to initiate the breastfeeding within the first hour of life. So these are the practices, and the evidence suggests that the countries which have followed these practices with the help of lactational counselor and antenatal counseling session, the breastfeeding rates have definitely.
What about LSCS, cesarean?
So the high cesarean rate also in the country has led to decreased breastfeeding rate. So
I'm
there is
talking about
evidence
when you're
that
doing a
if,
cesarean,
yeah.
how will you ensure that the child gets the colostrum in the first hour?
So because majority of the cesareans are done in the spinal anesthesia, so mother is conscious and awake. So we should ideally be feeding the child. The person who is taking the delivery, once the umbilical cord is cut and the baby is being, temperature is being maintained, the child should be put on the mother's
Are these
lap.
why? I mean, are these like why they are not mandatory?
So this is, see, the neonatal resuscitation guidelines have made now. So that is actually mandatory, that irrespective of the delivery, if the child cries after birth, there is no need of cradle or radiant warmer.
Therefore, I'm saying that not getting colostrum, not giving colostrum, or the child is not getting colostrum, you have to reason out why.
Yeah.
I'm say now if you go to the Organ Transplant Act, the new 2014 or 15 guidelines says about required request. There is a clause called required request. If the person dies brain death, it is required by law to request for a donation. Similarly, there should be a required
There should
request
be, definitely.
that
I think it
colostrum,
is-
that for every time you will have to put down in discharge summary whether colostrum was given or not. If not given, you have to reason out.
I think this is the need
This is
of
what I'm saying.
this is need of our, that healthcare should be actually responsible for providing colostrum to the child, to each and every day.
No, you know what I'm trying to say. I'm trying to be too harsh. I'm trying to say is that not giving colostrum, that every discharge ticket
Right. Should be mentioning that whether
should
it
be
has been
mentioning
given,
whether
it has been
colostrum was given or not.
so that it can.
And if it was not given,
what is the reason for that?
you need to give a reason out of it. If that happens as a column,
As a column. Yeah.
so as you write down vaccinations given, similarly cholesterol should be a column, given or not given, and if not given, you need to reason out.
So see, even in the message which has been published in this breastfeeding week by WHO and the UNICEF, they say that breastfeeding is one of the most smarter investment a country can do to raise the well-being of the
I am
See,
trying to
we are
say.
no, I mean, in the country, the
See, my concern is different. My concern is that
why it's not there.
30 deliveries taking place in the night. Cesareans going on. One doctor is doing cesarean, out next, out next.
So actually, that
In
comes
that
to
situation,
other
unless it is
aspect that
mandatory.
manpower.
No, unless it is mandatory.
Hmm.
Unless it is a mandatory.
Yeah.
Mandatory means that you are answerable at the time of discharge.
Hmm.
Why cholesterol was not given? You can be questioned.
Right.
So then it becomes like counting of swabs in OT now has become like a routine.
Yeah. So before and after. Yeah.
So it doesn't take time. So it's a child received cholesterol or not should be the checkout list.
So that can be ensured only.
This is what I'm talking about.
It can be ensured only if there is direct observation of the first feed by the nurse who is
By the nurse who is taking care
yeah,
of the child.
yeah.
So what he is talking about is something like dots.
Yes.
Hmm.
So on the lines of
Directly
dots, it
observed,
has to
yeah.
be directly observed first feed.
Directly observed first.
That's a very good.
Very good suggestion. Yeah.
Directly observed
Directly
first
first
feed has
feed.
to be directly
First
observed.
DOFF.
DOFF. So that can be IMA recommendation today. Okay, we still have around 10 minutes with us. So before we go further, let's summarize. So summarize is that antenatal care must involve,
The counseling regarding
Counseling.
breastfeeding.
we need lactational counselors.
Yeah.
We must have a directly observed
First feed given
First
to the child.
feed given to the child. We
Within
must
first hour of birth.
0 to 1 hour. And the discharge ticket must mention given or not. Now, if it is not given in the first hour, it can still be given.
Yeah, it can.
So the first day, so no out unless cholesterol given. So
It
from
should
the labor room or from the
So in the hospital, if there is no other milk is available or no box should be there, other milk is there, then obviously the breastfeeding will be prominent.
no, I'm only talking about cholesterol, the first feed.
Yeah.
I mean, they should not be
Should not be.
wasted, it should not be discarded with that. And then we talk about it 0 to 1 hour, then we talk about 6 months, then we talk about 6 months to 2 years. These are the points which we have been able to
Mention.
mention.
Yeah.
With
Importance
that.
of thermal.
And then we come back to is that no water,
Mm.
medicines yes.
Mm.
Medicines yes. And then every mother should know her rights, the maternity benefit rights. And that should be respected. Maternity benefit rights should be respected. Twin care, there is no problem. Triplet care, there is no problem. And then we talked about is that cord should be cut after 1.5 minutes,
Mm.
so that more and more blood comes.
It comes.
And kangaroo care
Should be given even for term
even
babies.
for everybody,
Yeah.
And we also came out is at birth, mother and child should be mother's lap.
Yeah. So in routine care, the mother and baby should be kept together. They should not be separated. No place for cradle if the baby is crying at the time. of
No cradle. No. We are promoting the concept of delivery in the room, if possible.
If possible, definitely
In the OT.
resources.
No, I think we have to, if possible.
Yeah.
And we are also talking about if there is a cesarean, it should be in the vicinity,
Mhm.
if it is possible. Okay. And then we talk about does it make a difference if the father is there in the mother's delivery room?
So support for the mother. So
No,
support
I'm taking it the other way around. I'll link it to directly
Maybe,
observe
yeah,
first
maybe,
wedding.
yeah,
Because
yeah.
mother is
that's the
mother
right
is
method.
emotional, mother is that. I can give that job to the father. He is ensured
Mm.
that his job is to ensure that.
Ensure that the first feed should
Otherwise,
be-
what is he doing? Where is the support?
Yeah.
And then one of the support shall be
Should be first directly
so
observed.
directly observed first
feed.
feeding. DOF can be the job of the father to look into it
Mm.
with that. Is that. Anything else? We have.
No, apart from this, one should ensure that the gynecologists, pediatricians, and the nurses in the institutions, they should be trained, well trained. They should get exclusive training on breastfeeding. And it is not very easy, this thing. They require at least 3 to 4 days continuous training on this.
And then we came back to the skincare. We talked about some aspects of skincare. What about vaccinations now? Vaccination did we cover? No, we didn't cover about vaccination. So at birth.
So at birth, every baby child should be immunized for BCG vaccine, oral polio, given the first dose of oral polio vaccine, and hepatitis B vaccine.
So I have to talk about is that at birth, colostrum, breastfeeding should start, and he should be given 3 vaccines. So I have to combine them together. Otherwise, what will happen is
one thing can be missed.
One thing can be missed with that. Any testing we do at the time of birth? Any contraindication for breastfeeding?
Yeah, very relevant question. So majority of the conditions, majority of the drugs which mother is taking, mother can breastfeed. Only thing that if she is taking anti-metabolite drug or she is under radiation therapy, then she cannot breastfeed. Second thing is that if she has miliary tuberculosis and that is untreated, then she cannot breastfeed. But within 2 weeks of that, within 2 weeks of starting ATT, she can start breastfeeding. And if she has got active herpetic lesions on the breast, then that is the condition in which she cannot breastfeed. For our country, even if the mother is having human immunodeficiency virus positive, then also we should give breastfeeding and it should be continued. There is no doubt in that.
So unless your doctor says no, there are reasons for doing that, you should be able to continue breastfeeding with that.
And there is one infantile condition in which the breastfeeding is not being done, and that is if the child is suffering from galactosemia. Galactosemia. Because the breast milk contains lactose, which converts to glucose and galactose. And
well, let's revise benefits of breastfeeding. Early.
So benefits of breastfeeding we will do it for the child, to the mother, to the society.
So child, to the mother, to the society. Child.
So let's come to child. So for the child, early you are that less risk of infection.
Less diarrhea. Less RTI.
RTI, recurrent otitis media. Then later on, when the child grows older, then less risk of type 2 diabetes mellitus, less risk of coronary artery disease, less risk of childhood obesity, and better neurodevelopmental outcome. The IQ point is higher if the child is being exclusive breastfed.
Benefit to the mother.
To the mother, less chances of anemia because postpartum hemorrhage is less, good source of contraception, the less risk of breast and ovarian cancer, and less risk of obesity. She regains the original shape earlier.
What about society?
So to the society, it is more economic. It takes away the difference between rich and poor because breast milk is something which is available to everyone, and if the breast milk, exclusive breastfeeding leads to better outcome and IQ score is better, then the gross capita income of the country can also increase because of better academic performance, etc. And we discussed it can increase by an amount of 4,300 crores per year.
So I think it's a good message we have come out with. We have with us Dr. Naveen Gupta, who is a specialist neonatologist from Max Super Specialty Hospital, Patparganj, and we are observing breastfeeding week, and IMA promotes. IMA stand is very clear that at a national level, all the doctors in the country, whether they are neonatologists or not, whether they are pediatricians or not, whether they are gynecologists or not, they must pass on the message of promoting breastfeeding. If every doctor starts promoting breastfeeding, if they find, suppose for example, I am a cardiologist, if I got a patient and if I happen to see a pregnant lady coming with a heart patient, so I should immediately after seeing the heart patient, I should say, how are you? Have you taken the lactational counseling or not? So that can be one of the questions which every doctor can ask. Have you taken lactational counseling before the delivery, during the delivery, or after the delivery. And the word kangaroo care should be promoted in India. Kangaroo, we only talk about kangaroos when Australia comes to India and we start having a cricket match. I think we should talk about the concept of kangaroo care in every aspect of child. That's all today. That's all for today. We will come back next week with one more session. Till that, I, Dr. K.T. Agarwal, Honorary Secretary General IMA and President Heart Care Foundation of India, and along with me, Dr. N.V. Kamath, former Director Health Services, Delhi Government, and currently the Principal Advisor, IMA, thank our guest, Dr. Naveen Gupta, who is a neonatologist and who is practicing in Max Super Specialty Hospital. We say goodbye to you. We'll see you next week with some more topic. We thank Johnson & Johnson to be our partner in this public health initiative.
Thank you.